This is the Restorative Medical Cock-Up. We make these in sizes from newborns, toddler, all the way up to adult sizes of small, medium, and large. We also can make it in extra large. Always assume at Restorative Medical, if you don't see it on our website or in our catalog, that we make it, or we will be happy to make it for you. It's one of the nice things about manufacturing here in the United States, in Brandyburg, Kentucky. We're just south of Louisville. And by doing that, we have the flexibility to customize, to make different sizes, to do different strapping, to tweak things in just a little different way to make it exactly what your patient needs. That's another difference in orthopedic and restorative. You can pretty much depend on your orthopedic patient's conditions being similar. You know, you have a blown out knee, you have knee surgery, you have hip surgery, you have whatever's going on, hand surgery. But with restorative, you never know quite what condition your patient will be found in. Sometimes their contractures, their deformities are so overwhelming that we have to step back and just take one step at a time. But the cock-up is very simple. It's very comfortable. It doesn't have metal stays in it. It's not material, coarse fabric that's going to give you sores in the web space of your thumb. It's very comfortable. It's very padded. This is actually an Outlast fabric. We use it on our hand splints. It's a thermal regulating material that was designed with NASA for the astronauts' spacesuits to try to maintain a continual temperature. So it is manufactured at a certain degree centigrade, and it'll go through a phase change. Basically, if your hand heats up, it will release energy, or it'll store energy and cool you down. If your hand cools down, it will release that energy and warm you up through a phase change. So it's quite exciting, and since hands are so sweaty, especially with some of our neurological problems, spinal cord injuries, for example, they sweat a lot. So the object of the cock-up most of the time is to put you in about a 30-degree cock-up at the wrist. This is typically for carpal tunnel syndrome, where you have an area in here that is inflamed, and in order to take the pressure off that and allow it to relax, you want to cock the wrist up. And we've done very well with these. We have people that even just sleep in them and find them very beneficial. If we can prevent surgery, which we know we have, then that's very exciting. You simply wrap the straps around, and you have free function of your fingers and thumb, but it does hold your wrist at a nice cocked up advantage. Like I say, it's comfortable to sleep in. You can wear it around the house. You can wear it out. But it's also good for your patients that just have wrist involvement. Maybe they have wrist drop, and they want to be able to push their own wheelchair or do other things during the day. This allows them to. You wouldn't want that cock-up. You would, again, heat mold. It has the same high temperature plastic in the back that you use a heat gun. Remold that to what degree you need for your wrist. And then it supports your wrist while you've maintained the function of your patient, and they're able to do certain things for themselves that they couldn't do with a full hand splint that would be under their fingers and thumb. So this is the Restorative Medical Cock-Up.